Welcome to Safe Transfers 101. I'm Deborah Callendar. Everyday caregivers and healthcare professionals perform dozens of transfers, but three common mistakes continue to cause injuries for both caregivers and the people receiving care. It's important to understand how to properly transfer someone, and it is about protecting both yourself and the person that you are trying to transfer as well. Transfers are like a carefully choreographed dance between the caregiver and the care recipient, and success depends on some critical elements. This clip is going to look at us how to transfer from sit to stand, but the basic principles of transfer apply whether or not the person is lying in bed, rolling onto their side, going to a chair, or getting up from sitting. So let's get started. So let's take a look at the essential transfer sequence. Before any transfer begins, we need to ensure that we've got everything in place. If we're doing sit to stand, we need to ensure that we have a sturdy chair that has armrests, non-slip shoes for both you and the person that is receiving the transfer. And we want to make sure that any assistive devices, walkers, canes, etc., that might be needed in the transfer are nearby and within easy reach. We also want to make sure that the path of the transfer is uncluttered so that we don't have any obstacles on the floor that can trip either ourselves or the person executing the transfer with us. It's important for us when we're doing the transfer to position ourselves properly. I suggest using a staggered stance with one foot ahead of the other and slightly out to the side for better balance. Never twist your torso during transfers. If you are swinging the person from one surface to the other, face the person as much as possible. Spread your legs more than hip width apart with knees slightly bent and swing the person over in a way that doesn't require twisting of the spine, but rather movement through the knees. We want to position the patient for success. So the command is usually feet back, nose over toes, hands on the chair, now push to stand. You can say other commands as well. You can say now push to stand, or we can use a synchronized count like 1, 2, 3, stand to coordinate with the movement and to help build momentum for the patient. We also want to make sure that when they are sitting down post the transfer, that this is a controlled activity. We don't want them to drop into the chair as this can eventually give them back pain. And it's also just a poor habit to get into. It doesn't improve leg strength. So we want them to shift back so that they can feel the chair behind their knees. So they should always make sure that the chair is present before they sit, and they can put their hands on the chair or the chair seat to ensure a safe, controlled descent. Next slide is a demonstration of getting up from sitting down with the command that I've just mentioned.
Feet back, nose over toes, hands on the chair, now push to stand.
So let's look at the three critical mistakes most people make when they're doing transfers and how we can fix them really quickly. Even experienced caregivers can fall into these very common transfer traps, and it's really important to recognize and correct these mistakes immediately because it causes injury for both the caregiver and the care recipient. The first one is pulling the patient by their arms. The problem with this is that pulling someone up by their hands or wrists puts a lot of strain on the joints, and it frequently causes shoulder injuries. You want to guide them to use their hips and to push up using the armrests. Leaning forward as well helps with the momentum and shifts the weight so that they can stand. Our role is to provide stability, not to lift their full weight. Mistake number 2 is standing too fast for the patient. The problem is that when we rush transfers, this can cause dizziness and loss of balance or falls because you might have a sudden blood pressure change in the patient with sit to stand. You want to always count together and encourage them to lean forward first. Give them time so that their body can adjust before asking them to stand, and ask them how they're feeling before you ask them to stand. If they say they're feeling dizzy or they're not feeling well, give them a little bit more time before you try to stand them. Mistake number three is getting up from a chair that is too low. Low chairs make transfers extremely difficult and also dangerous for the caregiver because this is the most likely scenario in which you're going to badly injure your back. It requires much more force and awkward positioning on the part of the caregiver to get a patient out of a low chair. The fix for this is to add a firm cushion to the chair or raise the seat height. You want a height that allows the knees to be on the same level as the hips, or that translates into knees being at 90 degrees when seated. If your bottom is below your knees, the patient's bottom is below the knees when they are sitting, that means the chair is too low for them to stand up from easily. The ideal height is knees and hips in the same line, and if not, bottom above knees is preferable to bottom below knees. You can download the transfer checklist in the free Dementia Caribbean community. The links for that are in the description for this video. The paid community will have full videos and a troubleshooting tree, as well as guides and step-by-step videos for other transfers in addition to this one. Join our community for ongoing support and access to demonstrations that can help boost your confidence and keep everyone safe, as well as live Q&A every Thursday with me so that you can ask any questions that you need. Thanks for listening to me. Remember to like and subscribe to this channel and share this video to a caregiver who might need it.